Craniosacral therapy stems from the idea that there's a direct relationship from the skull to the end of the spine.
What we work off of is a craniosacral fluid flow. And in your head, you produce craniosacral fluid for 3 seconds, and then it absorbs for 3 seconds. And it creates a rhythm through the whole body. A lot of people think that the work is like energetic work only. There is an aspect to it where we use energy work, but it's a very small portion of it. The bulk of the work is actually done through tuning into this rhythm. It's kind of like the pulse.
Paula Stanko was suffering from severe back problems. She says she would even bring a tennis ball to work to try and relieve some of the pressure on her back. But things have changed since Paula started this type of therapy.
There was a release that happened, and I have since been I've been coming to see Cherise for craniosacral therapy. I've put away the tennis ball. I don't need that anymore. It's been really freeing and wonderful experience.
Craniosacral is more client-directed as opposed to therapist-driven. It works on not only physical but emotional release.
There is another aspect to the craniosacral work called somatic emotional release. And essentially when tissue has been traumatized in any sort of way, trauma is a pretty big spectrum, so anything from something small to something big. Any emotion you're experiencing at the time of the injury gets locked into that area.
This type of therapy is recorded to have helped ailments like migraine headaches and fatigue to immune disorders and scoliosis.
I just feel just generally healthier, just generally happier, just generally, it seems to be a mind, body, spirit kind of thing. I find that craniosacral therapy has become that missing piece of the puzzle.
And this treatment could work for you. For Shaw TV, I'm Lisa Wolanski.